Have you ever wondered how to give an intravenous injection correctly? This is a question that has likely crossed the minds of many medical students. Mastering the art of intravenous injections, also known as IV injections, is a crucial part of becoming a qualified healthcare professional. You see, intravenous injections are not just about getting the needle into the vein. It's a precise and delicate procedure that facilitates the direct delivery of medications or fluids into a patient's bloodstream. That's why it's commonly used in hospitals and clinics worldwide. One key aspect of IV injections is the concept of bioavailability. It's the degree and rate at which a substance, in this case a drug, is absorbed into a living system or becomes available at the site of physiological activity. With IV injections, bioavailability is typically 100% because the medication bypasses the digestive system entirely. Drug is either given as bolus intravenous injection, for example, adenosine in PSVT and furosemide in acute pulmonary edema. It may be given as slow intravenous injections over 5-10 minutes, for example, calcium gluconate in arrhythmias. Slow intravenous injection, for example, oxytocin for induction of labor because slow and sustained action is required. Rapid intravenous infusion is given for providing fluids in cases of shock. Knowing how to administer an intravenous injection properly is a vital skill for any healthcare professional. Now, let's dive into the step-by-step process of administering an intravenous injection. First, you need to select the appropriate equipment. This typically includes a syringe, needle, tourniquet, cotton, and antiseptic solution. The size of the needle usually depends on the patient's vein size, with larger veins requiring larger needles. Next, we move to preparing the patient. Greet the patient and take consent. Always explain the procedure to the patient to alleviate any fears they may have. Make sure the patient is in a comfortable position, typically with their arm extended and supported with tightly closed fist. Wash your hands with soap and water. Now we come to selecting the injection site. The most common site is the cubital fossa, where the veins are easy to access. Apply the tourniquet and wait for a while for the vein to swell. Remember, always rotate the injection sites to prevent damage to the veins. Disinfect the skin in one direction only. The angle of the needle is crucial here. Hold the needle at an angle of about 35 degrees to the skin surface. This will allow for a smooth insertion into the vein. Then we proceed to inserting the needle. Be gentle and steady and remember to be patient. Once the needle is in the vein, you'll see a small flash of blood when you aspirate, which indicates that you've hit the vein correctly. Now, loosen the tourniquet. After this, slowly inject the medication. Be mindful of the patient's reactions. If they show signs of discomfort, you may need to slow down or stop the injection. Once you've injected all the medication, gently remove the needle at the same angle you inserted it. Apply pressure to the site with a cotton ball to stop any bleeding. The final step is aftercare. Clean the injection site with an antiseptic solution to prevent infection. Secure the injection site with an adhesive tape. Monitor the patient for any immediate adverse reactions to the medication. Lastly, clean up, dispose of the waste safely, and wash your hands. And that's how you administer an intravenous injection. All these steps have to be demonstrated during your second MBBS Pharmacology Practical Viva. Remember, practice makes perfect. But what happens when things don't go as planned? It's a valid question and one we need to address. Intravenous injections, while highly effective, can bring about complications. For instance, infection can occur if the injection site isn't properly cleaned. To avoid this, ensure you sterilize the area thoroughly. Next up, air embolism, a potentially fatal condition where air enters the bloodstream. This can be avoided by removing any air bubbles from the syringe before injection. Lastly, we have thrombophlebitis, an inflammation of the vein. This is usually caused by a needle that's been in place for too long or is too large. To prevent this, remember to change the needle regularly and select the right size for the vein. Intravenous injections also have a risk of drug overdose since the medication goes directly into the bloodstream. Always double-check the drug dosage before administration. Being aware of these complications and how to avoid them is just as important as knowing how to administer the injection itself. So why choose intravenous injections over other methods of administration? Well, there are a few compelling reasons. Firstly, intravenous injections provide rapid onset of action, which can be crucial in emergency situations where every second counts. Titration of the dose can be done. This method also allows for the administration of large volumes of medication or fluids. something that oral or subcutaneous routes might not accommodate. It is beneficial for unconscious, uncooperative, and vomiting patients. First-pass metabolism is bypassed as the drug directly reaches the circulation, giving 100% bioavailability. Furthermore, intravenous injections offer complete bioavailability, ensuring that the entire dose of the drug reaches the bloodstream and can exert its full therapeutic effect. However, every silver lining has a cloud. Intravenous injections come with the potential for complications. These can range from pain, infection, and inflammation at the injection site to more severe systemic complications such as air embolism or an allergic reaction to the administered drug. And so, as with any medical procedure, it's essential to weigh the benefits against the risks when deciding whether to use intravenous injections.